Hi, my name is Elizabeth McLaughlin, and I am a urologist specializing in male sexual wellness at Urology Associates of Denton in Denton, Texas. Our clinic is located at 3204 Colorado Boulevard. As one of the few urology practices in the area, our patients know they will never be treated like a number. We treat both men and women with problems in the urinary tract, but we especially specialize in men with issues of the reproductive system. Over the past year, we have treated 240 male patients with infertility issues. Of those 240 men, 15 were diagnosed with aspermia, which demonstrates just how rare this condition is. There are very few obvious symptoms of aspermia, but it mostly characterized by the lack of semen at ejaculation, meaning the male experiences dry orgasms. Many of these patients experience hazy urine at the peak of sexual intercourse caused by leakage of sperm into the bladder. Some also experience pelvic pain after ejaculation with very little amounts of semen being ejaculated at the time, thus leading to their inability to reproduce. Some may also feel tenderness around the testes. Commonly, the treatment for this condition is centered around alleviating the causes of the condition. Depending on the circumstances of the patient, there are options for assisted reproduction, intrauterine insemination, bladder sperm harvest, or even surgery. The nature and duration of the treatment for this condition is heavily based on what caused it in the first place. A few months ago, a young man came into our clinic complaining of dry ejaculations. He was a newlywed 26-year-old white male who was fresh out of graduate school and at the beginning of his new career in marriage. He had no previous medical issues prior to his visit to our clinic. Him and his wife had been trying desperately to conceive a child when they noticed that intercourse became too painful to do that any longer. After further examination, I found that his aspermia was caused by an ejaculatory duct obstruction, and I found a congenital cyst on the ejaculatory duct. The treatment I suggested for him was an outpatient procedure called transurethral resection of the ejaculatory ducts. My recommendations for this condition on a broader scale is to educate males that although this issue is rare, it is highly relevant in urology today. It is something that patients should address immediately following experiencing the symptoms of aspermia. In terms of other health professionals treating this condition, it is essential that you thoroughly evaluate the specific causes of the disease so you know how to best treat the patient. Although it seems like we as urologists have this condition figured out, there are still some major problems that need to be solved. For instance, there are very limited natural options for men seeking treatment for this condition. Also, it is essential that patients do their research and visit the doctors who specialize specifically in this field.